Hi everyone, good day. For today we'll be discussing about your defense mechanism. Defense mechanisms are very important concept under your psychiatric and mental health nursing, and it's very essential for us to know what are your DMs, um, what is DM in the first place, what are interventions, or what are we gonna do, what are the signs or what are the types of your defense mechanism. Okay, so let's try first to define what is defense mechanism. So when we say defense mechanism, it is otherwise known as your ego saving mechanism. It has been started by Anne Freud and Simon Freud. They've studied these defense mechanisms in their study of mental health of a person. So DM or defense mechanism is used by an individual to protect himself from anxiety. Why? Bakit may defense mechanism? Simply, naturalisa po ng isang tao um, to protect his or her ego against an anxiety, or that's the natural being or the natural attribute ng isang tao, ang protektahan ng kanyang sarili. Okay? So we use defense mechanism as our anxiety increases. So from there, you will know that DM or defense mechanism, from the word itself, ego saving mechanism, is a very important attribute ng isang tao. Lalo-lalo na no, for those people who are having these psychiatric and mental health disorders, it's very important for us and necessary to identify when a patient is using defense mechanism. Okay, so that we'll be able to do our interventions, we'll be able to conceptualize management, and our care plan for a patient doing this, okay, and utilizing their DMs. So now let's try to know what are the different types of your defense mechanism. So when we say DM, marami yan, napakaraming types niyan, and we will be enumerating some and most common of those. First, let's have compensation. So kapag sinabi natin compensation, it means that a person is putting an extra effort to counterbalance perceived deficiencies by emphasizing strengths. No, common to sa mga tao na may mga kahinaan, no? May mga kahinaan. They are actually doing a counterbalance, okay? That they have acknowledged for a very long time already, and they will portray and they will try to counter it, no? By using strength, by using power, by using their attribute and anything that they have, okay, to overcome that deficiency. Say for example, a small stature person who negatively perceives being so tries to overcome it by being aggressive, forceful, and controlling business dealings. So, isang malaking halimbawa nito is you have a boss at work, and then your boss have this very small stature, hindi siya katangkaran, pero alam niya yon, and it has become his own and personal insecurity. So, now, kinukutsa siya doon, and he knows that it's one of his negative attribute. So he tries to counterbalance it by being so aggressive as a boss, being so forceful and authoritative as a boss, and controlling business dealings. So mahirap ang boss na yan if he is doing such defense mechanism. Okay? So remember that one. That's compensation. Another is your conversion. So when we say conversion naman, kapatid, this is the expression of emotional conflicts through physical symptoms that have no organic or physiological cause. So there are some, no, na halimbawa po nito, no, a person who develops chronic abdominal pain after an emotionally traumatic event, and there was no identifiable cause found for the symptom. So common to, no, halimbawa you have a friend or may kaibigan tayo na kapag na-stress siya, kapag at times na very stressed siya, sumasakit yung kanyang tiyan, sumasakit yung ulo, or there are some body aches that's being felt, that's what we call as your conversion. Okay, again, these are your defense mechanism, and these are actually ego-saving mechanism, and as we go along, you will try to learn how are your DMs very important in saving the ego of a person and in diminishing and decreasing the patient's anxiety. Okay? So, please remember that conversion as a defense mechanism is different from conversion disorder. Conversion disorder are those types of disorders, say for example, your pain disorder, na kung saan yung ating pong emotional conflicts turns into symptoms. Because yung conversion disorder, they are those that are chronic in type and then naka-install na po siya sa pasyente. Okay? So that's different. Conversion as a defense mechanism is just being used, no, subconsciously and unconsciously by a person who develops or who is trying to face and battle with anxiety. Okay? So another thing is your denial. So denial is ignoring or refusing to accept and acknowledge realities from the word itself. No more words. Ignoring or refusing to accept and acknowledge reality. So hindi natin natatanggap ang realidad. So that's what we call as your denial. So, best example nito is that saying it's fine to be single after a long-term committed relationship. So, after a breakup or after separation, you said na it's just fine being single. So, that's an example of denial. Okay? So, this is the type of defense mechanism that I know we are all very, very familiar with. Next is have displacement. So when we say displacement naman, kapatid, this is redirecting feelings, stress, and emotions to a less threatening person, object, or situation. So, halimbawa, a 3-year-old child is very angry after being punished for writing on the walls. Okay? So, afterwards, anong ginawa ng bata? The child begins to hit his or her toys and throws them away. Yan. So, tandaan po natin, displacement is a manner of channeling your anger, okay? Or anything that makes you burdened. Okay? So, that's what we call as your displacement. So, ikaw yung pinagalitan and then dahil you cannot counteract yung nagalit sa'yo, halimbawa it could be your boss, it could be your parents, ang ginawa mo is you turn your anger to a lesser or to a less threatening person, object, or situation. So that's what we call as your displacement. Okay? So, compensation, conversion, denial, and displacement. Let's have another example of defense mechanism, dissociation. So, dissociation is the manner of blocking anxiety-provoking events from your consciousness. Okay? So, this is actually sometimes called as your suppression because you suppress your, you block or you suppress your anxiety-provoking memory, okay, from your consciousness. So, this is the conscious forgetting. Okay? Yung sinasadya mo, halimbawa, yung may mga utang sa'yo, yan. Okay? So, sinasadya mong kalimutan. So, that's what we call as your dissociation or suppression. So, example that we have here is that a person rushed to ER is unable to explain who they are and where they live or work. So, ito naman, you are trying to dissociate things, okay? Because, you know, you just came or you just went through an anxiety-provoking event. Okay? So, that's what we call as your dissociation. Another example is your identification. This is very, very common. Okay? So, identification is the manner of imitating. It could be consciously or unconsciously an admired person. Halimbawa, you admire an individual. It could be an artist. It could be someone near you, someone close to you. Okay? And then ginagaya mo siya, the way he talks, the way he walks, the way he dresses, okay? The way yung kanyang pagkakagupit. Okay? So, common to sa mga impersonators or those who are idolize some famous celebrities or persons. So, example, a 15-year-old adolescent gets a hairstyle of his young English teacher whom he admires. So, that's the best example here. Okay? Another is your intellectualization. This is also one of my most, commonly na ginagamit. Okay? So, excessive reasoning with basis like books and cognitive abilities without involving emotions or feelings. So this is the tendency of a person to explain or reason out by basing on intellectuality. That's why we have here books and cognitive abilities. Say for example, may isang you have a discussion with your friend and then you tend to not to parang you're always portraying that you know everything by basing or by using or stating facts that you have read it in the books, it could be in the magazine, or it could be in the Bible. Yun yung mga taong gano'n, no? May mga intellectually reasoning. Okay, they always reason out. So, example dito, a person who was called for overeating, halimbawa, no? Overeating, hoy, nag-overeat ka. Tapos sabi niya, it's just fine because as long as you properly calculate calories and refers to nutritional facts of the product, it's just okay. Yan. So you are trying to reason out by stating facts, by stating cognitive, by utilizing cognitive abilities. So that's what we call as your intellectualization. May kalaban to. Mamaya dadaanan natin because what we did is we had everything here alphabetically arranged. Okay? So another defense mechanism is your introjection. So from the word itself, introjection. So this is the defense mechanism wherein individuals incorporate traits or values of others into themselves. Okay? So halimbawa, ito common na linyahan ng ating mga parents, no? Papunta ka pa lang, pabalik na ako. So ngayon, dahil you've always been hearing that from your mom, from your father, or naririnig mo sa mga matatanda or nakakatanda sa atin, sasabihin mo rin sa nakakabata sa iyo, okay? Papunta ka pa lang, pabalik na ako. So an older sibling says to a younger sibling, he copied these values from parents. So that's what we call as your introjection. Okay? So you introject something that's from outer. Okay? From outer being. Okay? So that's what we call as your introjection. Or ini-incorporate mo. Okay? So that's what we call as your introjection. Okay? So next is isolation. So when we say isolation, this is blocking feelings associated with an unpleasant experience. So posibleng may pagkakapareha siya sa kanina sa dissociation, but we will try to explain and differentiate the two. So dito pa lang sa example, we will find it out already. So example of isolation is that a person or a medical student dissects a cadaver for an anatomy course without being disturbed by thoughts of death. So you are trying to portray na and you try to block off feelings associated with the current unpleasant experience so that you would be okay. Okay? So halimbawa ako, I don't really eat eggplant because when I was a child, I had this experience na yung pinakauna kong nakain na eggplant ay makati sa dila, sa buong bibig. So, every time na yun lang yung ulam or that's the available food that you have, you just eat and try just to portray, no, that it's just okay. So, ganon. That's what we call as your isolation. So, you isolate your self, you isolate your feelings or your emotions so that everything would be okay. So, that's what we call as your isolation. Another thing is your projection. Eto, so when we say projection, kapatid, kalaban to no ng introjection. Because in introjection, you are pointing out yourself. Ako yan, ako yan, ako yan. So, that's me. Or, I acquired that one. Projection naman is pointing out others. So, this is attributing or transferring one's own feelings, thoughts, or motives to others. So, that's what we call as your projection. Halimbawa nito, when nakikita ako sa mga reels, no, may mga videos na kung saan halimbawa may election kayo sa classroom during high schools, and then ikaw, you want to become the president, but projecting that you don't want to become one, you nominated your classmates, pero talagang gusto mo ikaw yung ma-nominate, no? So, an example nito is a cheating partner is convinced that his or her partner is cheating. Yan. So, because you are doing that, you are thinking also that your partner is cheating. So, that's an example of projection. So, you're pointing out others. Sino dito gusto kumanta? Siya. That's what we call your projection. Because you don't want, no, na ikaw yung magkakargo ng pagkanta because sometimes you become anxious or natatakot ka or may stage fright ka, ganun. That's what we call your projection. Now, number 3 on this list, we have your rationalization. So, rationalization is para din siyang intellectualization. But the difference is that in your intellectualization, you don't use factual basis. You just base it on your feelings or emotions, okay, to justify a behavior. So, this is excessive reasoning without basis. A person uses here emotions and feelings to justify a behavior. Okay? So, halimbawa, the same din yung example natin kanina. Huy, ikaw, kain ka ng kain. Marami ng kinakakain mo. Sabihin mo, that's fine. It's okay lang yan. Stress ako, yan. So, that's what we call as your rationalization. So, you don't state or you don't utilize your cognitive ability. You just base it from your emotions, your feelings, okay, to justify what you're currently doing. So, that's what we call as your rationalization. Another thing is your reaction formation. Reaction formation, this is actually the same with your isolation, but here, madi-differentiate din natin. So, reaction formation is developing conscious attitudes and behaviors and acting out behaviors opposite to what they really feels. So, kagaya din ng halimbawa ko kanina, yung talong. But here, the best example here that we can have, a married person who feels attracted to one of the spouse's friends treats the friend rudely. Okay, the isolation here is that it comes from a negative or unpleasant experience. Your reaction formation naman, not necessarily, no, na it's a negative experience or unpleasant experience. In your reaction formation, you are, halimbawa, when you get attracted, that's actually a positive thing. But it's because it is forbidden because it's one of your spouse's friend. So, ang ginawa mo, trinitreat mo na lang rudely. So, you are acting out something in reverse to what you really feel. Okay? So, that's what we call as your reaction formation. So, now, the last two for this list, we have your regression. So, regression is returning to an earlier developmental stage and pattern behaviors opposite to what one really feels. So, ang best example nito is an adult showing temper tantrums. Ang matanda, hindi na dapat niya nagte-temper tantrums. Buy me, tapos iiyak ka na, tapos hindi mo na kikibuin si mama. So, that's what we call as your regression. So, physically, ang nangyayari din to sa mga 7-year-old, 10-year-old na nagbe-bedwetting pa or umiihi pa sa kanilang pagtulog. Naiihi pa sa kanilang pagtulog. So, that's what we call as your regression. Okay? Lastly, we have your repression. Ito naman, this is somewhat may pagkakapareho with your suppression or dissociation. However, this is quite different because this is unconscious. So, talagang hindi mo sinasadya. Or unconsciously, you have forgotten something that's happened way back in your history of your life that is totally unacceptable. So, unconscious forgetting of unacceptable thoughts. So, halimbawa nito, a middle-aged woman does not recall her being sexually assaulted during teenage years. So, nakalimutan mo nang na sexually assault ka or you have been raped since you were when you were still young. It's because it causes you anxiety. So, those are your defense mechanism, kapatid. So, now, let's try to know what are your interventions with your defense mechanism. So, are we going to have our patient are we going to have them corrected with the acts that you do when they do their defense mechanism? The answer is no. So we need to assist client to identify source of anxiety to explore methods of reducing it. Okay? So facilitate appropriate use of defense mechanism because defense mechanism are not wrong. They are normal attributes of a being, and determine if the defense mechanism used was effective or have created additional distress. Okay, so kung nakadagdag yan ng additional distress, you know what to do. Okay, so avoid also arguing with the patient. You do not do that, and don't take away their DMs with them. Okay, so that ends for my discussion. I hope and I pray na may natutunan tayo from your defense mechanism. Okay, so see you guys on our next videos.